Okay, the next part of your crew is the psychology of your crew. What is the impact of drugs and alcohol? Visual impairment? Are you fit to fly? Are there psychological considerations? So there are 5 identified hazardous crew attitudes: anti-authority, impassivity, invulnerability, macho, and resignation. Anti-authority doesn't follow the rules, does whatever, doing its own thing. I don't have to follow the rules because they're dumb. Antidote, follow the rules. The next one is impulsivity. I don't care what you do, just do something now. Try anything, even if it's right or wrong, and there is no time to think about proper solution. Stop and take time to effectively deal with the problem. Invulnerability. That will never happen to me. I am invulnerable to the outcome and I'll never get caught, not me. Macho. This is the guy who's the hot dog. Hey, look at this. See how well I fly. And often is too cocky for our flying skills. Now, resignation. This is Ehor. I resign from the situation. What the use? I can't do anything right. It doesn't matter what I do, it's all wrong. The anecdote, anti-authority, follow the rules. Impulsivity, not so fast, think first. Invulnerability, it could happen to me. Macho, taking chances is foolish. Resignation, I'm not helpless, I can make the difference. These anecdotes are in the test data bank.
Another crucial element of CRM is recognizing and mitigating hazardous attitudes that can negatively impact decision making. The FAA identifies 5 such attitudes: anti-authority, which is resentment towards the rules; impulsivity, which is acting without thinking; invulnerability, the belief that accidents won't happen; machoism, which is taking unnecessary risks; and resignations, feeling hopeless. It is essential for the remote pilot in command to create an environment where these attitudes can be identified and addressed, implementing strategies to mitigate their influence on the operation.
So a good PIC crew should plan for contingency. What happens if you have to alternate landing or recovery site? Where are you going to do that? What happens if you have to, as a precaution, land away from the launch site? So I have to look at what am I going to do as an alternate. So let's say I have a landing site and for some reason a dog or a kid is there. I will often land on top of my car, the roof of my car, because it's high enough that keeps the kids from getting hurt. Communicate with air traffic control. If you are in or near controlled airspace, you should have a means to communicate ATC throughout the descent and landing if required. Normally, unless it's an emergency, it's not required. But if you have an emergency, a phone number is good to have in your pocket so you can alert ATC if the emergency progresses in a way that it endangers controlled airspace. You must plan ground operations for securing and parking the aircraft on the ground. I have these little cones that I mark out my landing site, and then in the center a landing pad. And make sure that you have control stations capable of launch and recovery, communicating equipment, adequate power source to operate the equipment. Check that your battery in your drone, if you use a phone, the phone and in the base station all have sufficient charge to accomplish the mission. You should take into consideration any airspace constructs and minimize risk to other aircraft by avoiding congested areas to the max extent possible. So flight termination. Flight termination is the intentional and deliberate process of performing controlled flight to ground. Flight termination may be part of a lost link. That's where your drone and your base station lose communication. Or it may be a contingency that you elect to use if further flight of the aircraft cannot be safely achieved. So if you activate your return to home, or you have a lost link that activates return to home, then that is the intentional and deliberate process, because your drone is under control by its software, but still is operating in a predictable manner. Or if potential hazards exist that require immediate termination of flight. So let's talk about drugs and alcohol. Part 107 prohibits a person serving as any role as a PAC or a crew member if he consumed any alcohol in the previous 8 hours, 8 hours bottled to throttle, is under the influence of alcohol, has a blood alcohol of 0.4 BAC or greater, using a drug, prescription, or OTC that affects a person's mental or physical capabilities. So if it says on the label, do not operate heavy machinery, do not fly under the influence of that drug. 8 hours bottled to throttle, even you can't cheat that, even if your blood alcohol is lower. So if you're convicted of a violation of state or federal statute relating to the growing, possessing, manufacture, sale, possession, transportation, importation of narcotic drugs, marijuana, depressants, stimulants, or other illegal subjects, it is grounds for denial of the application for a remote PIC for up to 1 year from the date of final conviction, or they will suspend the remote PIC license. So how long does it take for a single mixed drink, bottle of beer, to completely have no effect on the body? 3 hours. Watch this. Make sure the question's asking bottle to throttle, or how long does it take to have no effect on the body? Because even though the drink may be out of your body, you still have the 8-hour bottle to throttle rule. Fatigue. Let's just say you're a PIC for Co-op Energy Service. You plan to use your drone to inspect power lines in a remote area 15 miles away from your home and office. After the drive, fatigue impacts your abilities to complete the assignment on time. Fatigue can be recognized easily by experienced pilot, considered an impaired state by an ability to overcome sleep deprivation. B as in boy, it is considered an impaired state. Hyperventilation. Hyperventilation is the excessive rate and depth of breathing leading to an abnormal loss of CO2 from the blood. The common symptoms are visual impairment, unconscious, lightheaded, dizzy, tingling, hot and cold, and muscle spasms. So the question might be, what is a condition where your breathing becomes rapid and shallow? Hyperventilation. Another question might, what do you do to reduce stress in the field? Reduce stress at home. Stress. Stress is the body's response to physical or psychological demands placed on it. Stress falls into two broad categories: acute, that's short term, and chronic, that's long term. Acute stress involves an immediate threat that is perceived as danger. Chronic stress is defined as a level of stress that presents an intolerable burden, exceeds the ability of an individual to cope, and causes the individual performance to fall sharply. Based on statistics collected by the FAA, fatigue is frequently associated with pilot error, include degradation of attention and concentration, impaired coordination, deceased and decreased ability to communicate. These factors seriously influence the ability to make important decisions. Another thing that you may run into is dehydration. Dehydration is a term given to a critical loss of water from the body. The causes of dehydration are high temperatures, wind, humidity, diuretic drinks, coffee, tea, alcohol, and caffeinated soft drinks. Some of the common signs of dehydration are headache, fatigue, cramps, sleeplessness, and dizziness. If you are going on an area where it's going to be hot for the mission, then you ought to consider rehydrating solutions. Heat stroke usually follows dehydration, but it's a condition caused by the inability to control its temperature. The onset of this condition may be recognized by symptoms of dehydration, but it also has been known to be recognized only upon complete collapse. So what affects dehydration, heat stroke, vision flight, and scanning techniques?
Now, some of the key points to discuss will be fatigue, stress, alcohol and drugs, hypoxia, and what's so important here is visual acuity. And I saw this on the Part 107 exam. So I'm going to break these key points down to you. Start taking notes. Fatigue. This is one of the physiological factors that will impact your reaction time and decision making. Think about it. When you're tired, overworked, or worn out, do you react faster? Do you think faster? No. Your reaction time and your decision making will be affected by fatigue. The next one, stress. Stress can only lead to poor judgment and riskier decision making. You are unable to cognitively think about what it is you're supposed to be doing in the correct way. Another one for the Part 107 is hyperventilation. Now, this is what happens when you're breathing too quickly. This reduces the carbon dioxide in your blood. Now, the symptoms of this are dizziness, tingling, blurred vision, and poor decision making. Some of the reasons why you might be experiencing something like this could be contributed to stress, anxiety, panic attacks, or even high blood pressure. And on the Part 107 exam, there will be a question. How can a remote pilot reduce the effects of hyperventilation? And the correct answer is to breathe slowly into a paper bag or simply just reduce your rate of breathing. Next one, dehydration or lack of fluids. This can reduce your concentration, your coordination, and even your mental clarity. Can you imagine how you would feel in hot weather drinking too much caffeine on a long flight operation? Well, that's going to increase the dehydration in your body. And one of the Part 107 questions that you may see is, which of the following symptoms of dehydration could affect a remote pilot's performance? And the answers that you'll probably see on the Part 107 exam will be headaches, dizziness, and impaired concentration. Listen, even a mild form of dehydration can impair cognitive functions. So if you're flying for long hours, bring lots of water, take hydration breaks, and your brain and your drone will thank you. The next one, alcohol and drugs. Now, the FAA rules prohibit operation of a drone under the influence of alcohol and drugs. And the last one is visual acuity. Now, this is very important for remote pilots. You see, visual acuity refers to the sharpness and clarity of your vision, which is crucial for remote pilots under Part 107 rules and regulations. This is important because you, as a certified remote pilot, will be relying on your eyes to track your drone, assess surroundings, avoid obstacles, and good visual acuity is essential for safe operations. Now, one of the questions that you might see on the Part 107 exam will be something like this. How does reduced visual acuity impact a remote pilot's decision making? It can lead to difficulty in maintaining visual line of sight, which in turn can also lead to an increased risk of accidents or collisions.
Okay, ADM, the human factor. ADM and judgment, the human factor. Steps for good decision making are identifying personal attitudes hazardous to safe flight, learning behavior modification techniques, learn how to recognize and cope with stress, develop risk assessment skills. Make sure you use all resources available to you and self-evaluate. Are you ready to perform this mission? ADM is also known as risk management. So first you track, when does this behavior happen? Identify what is the trigger that causes you to enter in this unacceptable behavior. Do what you can to remove the triggers and then stay with the program. Under ADM, we must recognize stress, physical, which is noise, psychological, tired, personal issues. Remember, acute right now, fight or flight result, chronic long-term. That is extremely damaging long-term stress. Risk management. During each flight, a pilot makes many decisions under hazardous conditions. To fly safely, the pilot needs to evaluate the degree of risk and determine the best course of action to mitigate the risk. Can all risks of drone operators be eliminated? No. So risk management difficulties. Often most pilots are operating alone. So you have nobody to bounce it off. It's you. You are the only one to make the decision. If you are flying commercially, we are goal oriented. We want to get the customer's job done. And sometimes that drives us to do things that are not necessarily absolutely appropriate. And then, of course, there's the ego thing, a tendency to deny personal limitations. So here's a risk management matrix. So first thing you do is you identify, here's a hazard. How dangerous is it? So that's assess risk. What are the options I can use to mitigate the hazard? Decide to do it, implement that, and then did it fix the problem? And if it didn't, then go back and assess risk and keep going through the circle. Big thing is, how important is it? How risky is it? And use the feedback where you do an action to mitigate the risk. Did it work?
And taking a proactive measure on preventing accidents before they happen and also preventing them during flight. This means that you're constantly analyzing everything that could possibly go wrong. So there are 4 key steps in risk management. The first one is to identify the hazard. The second one is to assess the risk. The third one is to mitigate the risk. And the last one is to make a decision and monitor the situation. Now, identifying the hazard, the first one, and the second one, assessing the risk, are pretty self-explanatory, but there may need to be a little more clarification on what I meant when I said mitigating the risk. So, to mitigate the risk, if the risk exists, how can you reduce or eliminate it? That is what mitigation means. It's a strategy that you develop to reduce or eliminate. And the last one that I mentioned was make a decision to monitor the situation. What I meant was once the risk is reduced, decide whether or not to proceed or delay the flight. And after you've done that, continuously monitor the condition to see if there are any new risks that may arise and adjust your plan accordingly. What is the first step in effective risk management? The correct answer: identify the potential hazards before flight. Remember, risk management is not just about reacting to problems, it's about anticipating them and preventing the accidents before they happen. Smart pilots always think ahead.
So, risk management: never accept unnecessary risk. Make risk decisions at the appropriate level, which is usually the PIC. Accept risks with benefits that outweigh the danger, and integrate risk management into all levels of planning. That sounds like an answer to one of the test questions. Risk terrain. You need to evaluate the terrain, and it's a important consideration in planning your flight. Airspace. We need to pre-check our airspace before we start the mission and look also for TFRs. External pressures. So external pressures are influences external to the flight that create a sense of pressure to complete the flight, often at the expense of safety. Factors that can be external pressures include the following: the desire to demonstrate pilot qualifications, the desire to impress somebody, probably the two most dangerous words in aviation are "watch this," the pilot's general goal completion orientation. Are you willing to make shortcuts just to get the job done? Emotional pressure associated with knowing that the skill and experience levels may be lower than a pilot would like them to be. Pride can be a powerful external factor. Decision in a dynamic environment. In some cases, there is not always time to make decisions based on analytical decision-making skills. This type of decision-making is called automatic decision-making and naturalized decision-making. Understand your drone is only at 400 feet, and it doesn't take long if there's a problem for that drone to go from 400 feet to ground. You don't have a whole lot of time to react. So the next recommendation by the FAA is called PAVE. You as a pilot are not required to take a medical exam. You are to self-assess whether you're ready to perform the mission. And this is put into what's called a PAVE checklist. And is the pilot ready? Is the aircraft ready? Is the environment ready? And are the external pressures manageable?